Number one, you're having pain, and that pain is limiting your ability to have a reasonable quality of life. So that pain in your knee or that pain in your hip is stopping you from doing your daily activities at a level that makes your life desirable. Number two, we can see on an x-ray or we can see on some imaging study that the pain you're having matches with what we've got. And we say, okay, you have arthritis, and your arthritis is so severe that you can't do these things that you want to be able to do to have a good quality of life. And three, to treat that arthritis, we have tried multiple non-surgical treatments, whether it's taking pills or doing injections or modifying your activities or trying physical therapy, whatever those non-operative treatments may be. We've tried those and they aren't working. That's when I say to them, you got to think about this surgery, because the only way to definitively eliminate that arthritis that isn't getting better non-surgically and it's every day interfering with your quality of life is to move forward with operation.